some patients, they basically there's some deficiency in the jawbone, and we need to basically rebuild the bone or to kind of patch up some area that might have a little defect. And these bone comes from basically there's three ways of getting it. One, we harvest the bone from the patient's own mouth at the chin or at the ramus of the jaw, which we don't do that too much because it's really uncomfortable. Because now with the new cadaver bone that's available, these cadaver bone have been prepared much nicer and cleaner and very, very safe. They have gone through basically from chemical to radiation sterilization to temperature to basically break down any type of diseases or DNA that's in that bone. So all it is, what the body do is to take that bone and thinking that it's its own bone and then convert it into the patient's own bone.